Um, like Christy said, my name is Bria, and I'm a staff attorney at the Center for Elder Law and Justice, and we are partnered with the Region 15 Long-Term Care Ombudsman Program. So I'm happy to be presenting today on adult care facilities with Kelsey.
Yes, yeah, thank you very much. In the past, I've attended some Elder Law Day, and so this is the first time I'm presenting, so looking forward to it.
Okay, so before we get started, I just want to start with a disclaimer that this presentation is just for informational purposes, and it shouldn't be interpreted as legal advice, or the information contained is not necessarily applicable to a specific case or situation. So today, Kelsey and I are going to be going over the levels of care and adult care facilities, as well as admission and discharge criteria, how adult care facilities are paid for, and Kelsey will be going over the long-term care ombudsman program and how that is a great resource for residents and families. The adult care facilities in New York State are encompassed by 4 entities. The first one is adult homes. The second is enriched housing program. The third, assisted living residence. And under the assisted living residence, you have basic assisted living residence, enhanced, and special needs. And the fourth is Medicaid assisted living program. So this diagram is here to show the hierarchy of assisted living programs in New York State. So adult homes and enriched housing programs are at the bottom, and that's the lowest level of care. And each adult care facility can obtain additional licensure on top of that. And with each additional licensure that an adult care facility obtains, then the eligibility requirements are increased, as well as the level of care and services that the adult care facility is able to provide. So now I'm going to go through the 4 entities in more detail, starting with adult homes. So adult homes, like I just showed in that diagram, is at the bottom, and it's one of the lowest level of cares for adult care facilities. And they provide supportive residential care to residents. The setting is a private or semi-private room. They provide all meals and snacks for the residents, and as well as housekeeping and laundry. They assist with personal care, and this just means that they have staff that are able to give direction and some assistance with ADLs, such as grooming, dressing, and bathing. They have case management services, and what this means is that this is an initial and periodic evaluation at least once every 12 months. And with this evaluation, they look at the needs of the resident and the capability of the program to meet those needs. Um, and then they also are able to assist residents with adjusting to life at the facility. And then as well, under case management, help with medication management as well. And then adult homes also provide structured activity programs. So these programs can be individual or group activities, and they just help the residents to acclimate to being at the facility and meet other residents that are there. So the next entity for an adult care facilities is an enriched housing program. And again, that's one of the lower level of cares like adult homes. But unlike adult homes, enriched housing programs are primarily for adults that are 65 years and older. And no more than 25% of the residents can be under 65, but all the residents must be at least 55 and older. And the setting for an enriched housing program are like individual apartments. So each resident has their own living quarters. And unlike adult homes, for enriched housing programs, they're only required to provide 1 meal a day, which must be a hot meal, most likely in a group setting, so like in a dining hall. And they also provide housekeeping and laundry and case management services, like I explained previously, as well as structured activity programs. Sorry. I just wanted to add one thing that in enriched housing programs, they also have some staff that uh, have supervision for the residents, and this is just a general supervision, so just general whereabouts of where the residents are. So their residents are able to come and go as they please, but the staff at least know where the residents are for the most part. And staff are also required to identify abrupt changes in behavior and health for residents in an enriched housing program. So the third entity for adult care facilities is an assisted living residence. And this is now the next step, referring back to that diagram. So this is a little bit higher level of care than an adult home or an enriched housing program. So adult care facility will either be an adult home or an enriched housing program, and then they're able to obtain additional licensure. And then one of the licensure they can receive is an adult assisted living residence. So with an assisted living residence, they provide 24-hour on-site monitoring, and they have staff that are responsible for monitoring the residents. So this is more than just the general whereabouts that staff are required to do for an enriched housing program. Staff are also required to have the ability to respond to urgent or emergency needs of residents, as well as identify abrupt changes in behavior. And assisted living residents also provide case management, food services, and personal care and home care services as well for residents.
Yeah, I would say that they're the most common in New York State. So if you do go to an assisted living facility, it's going to be most likely this that we're talking about. And they, like I said, like Ria said, they might have additional licensures, but these are probably the ones you're most familiar with.
So assisted living residences, they're also able, they develop individual care plans for each resident. And what this is it is written details of the supports and activities and resources that are required for the residents to meet and achieve their goals. Um, and staff also coordinate with service providers that are selected by the resident on an ongoing basis to best address the residents' needs. And staff also need to maintain a complete and accurate personal records for the resident. So this includes their medication, daily needs, and any changes in behavior. And this is just to make sure that the staff are providing person-centered care for the residents. Next is an enhanced assisted living residence, and this is still under the third entity of assisted living residence. And enhanced just means aging in place. So with the enhanced assisted living licensure, then staff are able to provide residents with assistance as far as like transferring from a chair, or if they need assistance with walking or managing stairs. And this is something that's not typical for an assisted living residence. Usually residents are supposed to be more independent. So if they do require this additional assistance, then an enhanced assisted living residence would be best for them. And only a facility that has this enhanced assisted living licensure would be able to provide that level of care for the resident. But again, they're not able to provide 24-hour nursing care. So that's something that if a resident needed that, then they would have to go to a skilled nursing facility. So this special needs licensure is that third licensure under the assisted living residence, and this is for memory care services. So facilities are able to provide memory care services for residents that may have Alzheimer's and dementia. And with a special needs licensure, um, again, staff create that individual care plan for residents and case management services, and they're able to uh, identify when a resident is periodically resistant um, to certain services, and they're able to include plans for addressing those needs of the resident. And they also have activities that are geared towards residents that have memory care illnesses.
And sometimes that can be, you know, an entire building or just a wing or unit in some facilities, right, Bria?
Mm-hmm. Yes. So, yeah, so like Kelsey said, we can have, and we'll go into this a little bit later as well, but you can have facilities that only have one licensure, so they could have the whole building that is just has a special needs licensure, or they can have multiple licensures, so they'll have like a wing, like Kelsey said, that's just dedicated um, for residents that have memory care needs. So referring back to that diagram, now we're at the last entity for an adult care facility, which is an assisted living program. And this is the highest level of care that an adult care facility can provide. And this can be an alternative for nursing home placement. So residents that are in an assisted living program are eligible for nursing home level of care, and they're also on Medicaid, and it helps those residents age in place so they don't have to be transferred to another facility. So this is what I was referring to just moments ago. So this is a brief snapshot of a couple adult care facilities in Region 15. And I did Region 15 because we're partnered with the Region 15 Long-Term Care Ombudsman Program. But what this slide is showing is that you have some assisted adult care facilities like Brookdale that have 52 beds, and they're located in Erie County, and all their beds are adult homes. So they're only able to provide that lowest level of care. And the same is for Kenton Enriched Housing. They're an enriched housing adult care facility. So again, they're able to provide that lowest level of care, but their setting is a little bit different. They have the individual apartments that residents live in instead of the semi-private rooms. But then you have an adult care facility like Field of Dreams that's located in Cattaraugus County, and they're licensed as an adult home. But as you can see on the slide, they have obtained additional licensure. So they're also able to provide services for an assisted living residence, an enhanced assisted living residence, special needs residents. So they have memory care services as well as the assisted living program. So those residents that are nursing home eligible but are on Medicaid. And this slide here just provides that information that I just went over. So the first link has the profiles for all the adult care facilities in New York State. So you're able to go onto this website and look at if you're looking for an adult care facility, you can see what they're licensed as and if they have any additional licensure and what services they're able to provide for residents. And then the second link here, this just provides some additional resources for residents and adult care facilities and for families as well. So some of the things on this website are the Department of Health Adult Care Facility Complaint Hotline. This also has the link to go back to the adult care facility profiles where you can see the different licensures. And they also have resident resources. So they have brochures for resident rights at different levels of care for adult care facilities. So these are just two great websites for residents and families to get more information.
Yeah, I agree. You know, it's definitely important to do your research. And I know how confusing and complicated all these different licensures and levels are. It's hard to wrap your head around. Within New York State, not all states do this. So I would highly recommend going to these links and really educating yourself if you feel like you or your loved one is at the point where you're considering adult care.
Mhm. Now I'm just going to go through some of the admission and discharge criteria for adult care facilities. So prior to admission to an adult care facility, a resident will be screened to see if the facility will be able to meet their needs. And again, the resident cannot require 24-hour skilled nursing care. They would have to be um, a resident of a nursing home. And typically, residents cannot chronically need assistance with like walking and transferring and doing stairs. But again, that does not apply to an enhanced assisted living residence because they are licensed to provide that level of care. So New York law requires that if adult care facility is not able to meet the needs of the resident, then they have to be discharged or transferred to a more appropriate setting. And it's the responsibility of the adult care facility to identify those residents where they can no longer meet their needs at the facility. And the adult care facility is obligated to assist the resident and the family in finding an appropriate and safe living arrangement. So when an adult care facility wants to discharge a resident, there are only 6 reasons that they're allowed to do that. So it's important that if you're a resident in an adult care facility and the facility is telling you that you need to be discharged, they can only discharge you for these 6 reasons. So if they're trying to discharge you for another reason, then that's not allowed. So the 6 reasons are that the resident would require more care than the adult care facility is licensed to provide, that the resident poses and their behavior poses an imminent risk of death or imminent risk of serious physical harm to themselves or anyone else. If the resident has failed to pay the facility, if they repeatedly behave in a manner that directly impairs the well-being or the safety of others, and it interferes with the operation of the facility. Um, if the ACF no longer has a certain licensure to provide that level of care, or if the facility ceases to operate. The Center for Elder Law and Justice, we are able to assist residents that receive a 30-day notice of termination from a facility. So if that's something that may happen to you in the future, then please give our office a call because we would be able to assist you. And I just want to go over some common examples that we see. So a lot of times when a resident is issued a 30-day termination notice, we'll see that maybe their needs are higher than what the facility is licensed to provide. And that doesn't mean that they necessarily need to go to a nursing home. That means that they might have to go to an adult care facility that has additional licensure where they're able to provide more services to the resident. Or maybe in some cases it does mean that they may have to go to a nursing home because they may need that 24-hour skilled nursing care. A lot of times as well, we also see non-payment. So it's very important that people pay the facility on time, and if you think that you're going to run out of money, that you talk to uh, the facility as far as what your options are, because that is a valid reason for them to discharge someone. And like I just mentioned, if an adult care facility wants to discharge a resident, they have to provide 30-day written notice. and they have to put down on the notice what that reason is, and it can only be one of the 6 reasons that we went over. And the resident is allowed to object to the notice if they receive the 30-day written notice. And in that instance, the facility is then required to start a special court proceeding. And like I said, we do assist residents that receive these 30-day notices. So if you're in that situation, please give our office a call. So there are different ways that you can pay for an adult care facility. One of them is private pay, and this could average between $3,000 to over $6,000 for facilities. Another way is supplemental security income. So how this works is that the SSI would pay the facility the $1,535, and then the resident would be allowed to keep $222, and this is the resident's personal needs allowance. And then another way that you can pay for an adult care facility is what we had mentioned before, the assisted living program. So this is for residents that are on Medicaid. And with this program, you can do a combination of the SSI payment in addition to the Medicaid. I saw we had a question in the chat regarding the.
Yeah, I didn't want to interrupt you right there, but yeah, referring to a few slides ago, it's the special court proceeding, a summary proceeding regarding the discharge notices.
So it's not a summary proceeding. It's a special court proceeding. So what that means is that you would go to court in front of a judge. It's usually county court, and if it gets that far. So a lot of times when a resident objects to the notice, the facility will try and work with the resident and the family so that they don't have to go through the court proceeding. But if you do go through the court proceeding, then it's usually in county court, and then it's in front of a judge. So you would go through a whole hearing. The facility would present their side, the resident and the attorney would present their side, and then the judge would make a final determination as to whether the resident should be able to stay at the facility, or if they should be evicted and they need another level of care.
Does that happen often? Do you experience that? I was just thinking, for my examples, often, yes, the facility will want to work with the resident to avoid all that and the costly and the time to deal with the court issues. But also, unfortunately, sometimes, the family and of course the resident themselves, really thinks about, like, well, do I want to stay in a facility that, is trying to kick me out? I mean, they have every right to. I mean, who knows how long they've lived there. They have friends, they know the staff. But sometimes, the family and the resident, it doesn't reach that court point because they don't even want to, continue living there at this point. It's just not worth it. So sometimes they'll look for, another facility.
Right. And I've, since my time at Celj, I've been here it'll be almost 2 years. I've only seen 2 of these go to court. So they're very rare, because a lot of times, I mean, it costs the facility money to have to initiate this court proceeding. And a lot of times they don't want to do that. And there is a lot of negotiation with the 2 that I did see. There was a lot of negotiation beforehand, before it was even, brought to court, to see if something could be worked out between the 2 parties. So they are very rare. And I think a lot of times both parties either want to try and work something out, or, like Kelsey said, the resident and the family just decide that they would rather live somewhere else.
And to that note, we have another question that says, does this go through the ombudsperson to the point where they call us first? Yes. So again, from my experience, the resident or the family member will reach out to us and talk about this. We received a 30-day notice, eviction notice. What is, all these questions. What is it? What do we do? Um, and then we, talk about, well, what does what does the resident want? And if they want to stay, for a variety of reasons. And of course, especially if they're, have memory care issues, you really want to fight for them to stay there. 'Cause, you don't want to move them as little as possible. And it's about working with the staff, and it's all subjective too. So, if there's particular staff that can be re-educated or retrained, and maybe a resident will want to stay there, that's the ombudsman role. If it gets to the point where they do want, legal services or legal advice, then we absolutely direct them, direct them to the Center for Elder Law and Justice, because that's their world, and they can better answer those types of questions. But we'll help them if they want to, move to another facility. We'll give them, suggestions for other facilities in their area. But yeah, it can be an ongoing conversation.
Mhm.
I'm sorry, you have another question. Yeah, it says adult care facilities are not required to send termination notices to ombudsman, unlike skilled nursing facilities notices. So for skilled nursing facilities, they are, under regulation, legally supposed to provide us with discharge notices. So anytime anyone leaves a skilled nursing facility to go to a hospital, to go to another facility, to be discharged home, any of that, they need to let us know. Sometimes it's daily, sometimes it's weekly, sometimes they fax us a whole pile at the end of the month. But that's how we learn about discharges in skilled nursing facilities. And yeah, unfortunately, right now we don't know that, because we in adult care facilities, because they're not legally, required to. That's
Mhm.
true. James, are we getting another question here? What rights do the residents have to return to the adult care facility after a hospital or nursing home stay? Is the full payment due to the ACF during the absence? Yes. So, these adult care facilities, if you want to view it as, paying for your apartment.
Mhm.
And so if I know, for instance, my grandma, she was at an adult care facility, assisted living, and she fell, and so she needed to go to rehab at a skilled nursing facility for a few weeks. And so during that month, my family, we had to pay to, and luckily she recovered soon enough where she was able to go back within the month. But yeah, there are times where, it might be, you might be at the skilled nursing facility for a bit. But as long as you keep paying that, your rent, they should keep, the room open for you.
And that also should be listed, like when you are admitted to an adult care facility, you sign an agreement, and that should be listed in the agreement, like what your rights are. So that's something that you would know ahead of time as well.
Yeah, we might talk about this in another slide, but yeah, it's 100% the admission agreement. We stress for people who call in looking for information that that the ACFs are very different, governmentally regulated than skilled nursing facilities. So to 100% read in detail that admission agreement that you sign, because each facility has a different one.
Mhm.
And it's really important, to really ask questions and get clarification on that, especially when it comes to being discharged, the
Mhm.
policy about that.
And our office, we can, if you're going into an adult care facility and you're allowed to review it, ask questions before you sign anything, we can also, if you contact our office, we can review the admissions agreement for you as well if you have any questions, just to make sure that um, everything that's in there is supposed to be in there, and that they're not doing anything that's not in the regulations. So we can do that as well.
Thank you for your questions.
Yes, thank you. Okay, so before I switch it over to Kelsey, I just wanted to mention resident and family councils. So these are a great resource for residents and their families because they can join together and they can discuss various concerns that you may have in a resident in a facility with other residents and with other family members. And this could be about anything. So it can be about like procedures regarding outings. I know a lot of times during COVID, there's a lot of issues with visitation and the facilities policies and procedures around that. Um, but any concerns that you have, you can bring up at a council, and the facility is required to consider and act promptly on any concerns and recommendations that are presented from the resident and family council. So it just can be a great resource and tool for residents that are in these facilities.
Yeah, I agree. And it's under federal regulation to have them under the Older Americans Act. And as you can imagine, in adult care facilities, that the residents are more active in these than skilled, but they are required in skilled as well. And yeah, it's empowering. It's reassuring. It's comforting. It's a good and it's staff is not allowed unless invited. So it's a great tool for the residents to come together and share any good bad stories and bring those grievances, like Bria said, as a unit to the staff. And so every facility has an adult care or a residence council. Unfortunately, not every facility has family councils. They are more common in adult care facilities than skilled nursing facilities, because the residents often live longer, reside there longer at adult care facilities. So they really kind of can create these family councils and bond. But, we encourage them. We have information on how to get it going, and we can help facilitate that. And I know Center for Elderly and Justice does that as well. They can do presentations and get these family councils going. So just like the residents, the families can come together and talk and make change. Really feel empowered to make change within the facility. Someone has a question here. It's a long question. It's talking about budgeting for assisted living programs when there's a spouse living at home and another one and a spouse is in assisted living program.
So you can give our office a call and they would be able to provide you more detailed advice about your specific situation. Our healthcare unit, they they can provide like brief counsel on like Medicaid and Medicare, private insurance. So this is something that they would be able to assist with as far as like the budgeting and how that works when you have a community spouse. So please give our office a call. I'll put our number in the chat, and then someone from our healthcare unit would be able to further assist you.
Yeah, I recommend when you have Medicaid, really in-depth Medicare questions, to reach out to Center for Elder Law and Justice, because I mean they're the experts on that, and it's just constantly changing and it is extremely complicated. So it can be. So I definitely reach out to Center for Elder Law and Justice.
We also have a helpline as well. I'll put that number in the chat. So our helpline is every day, Monday through Friday. We have live calling hours from 9 to 11. And then after that, you're able to leave a message or send an email, and we're able to provide brief legal service. So you're able to speak with an attorney when you call and can provide brief legal service on your issue. And if it's something that we're able to handle internally, then they'll provide a referral to that specific unit. And if it's something that we're not able to provide help with, then we can provide you with referrals. And yes, we serve the 10 Western New York counties. So if you're in one of those 10 Western New York counties, then we would be able to provide assistance for that. So I'll put the number for, I'll put our helpline information in the chat as well.
Thanks. Well, thank you, Bria. So this other portion is focusing just specifically on the Ombudsman program, what it is, who we are, and in relation to helping residents in adult care facilities. So educating, our mission and motto is educating, empowering, and advocating. And if you can, sorry, Bria, you're in charge of the slides. So, what's an ombudsman? What does that mean? I know, when I first came to the term, as much as everybody, you have trouble saying it, let alone what is it? It's a Swedish term that generally just means advocate. So you can have ombudsman in a variety of places. I know my college had, student ombudsman. Hospitals have hospital ombudsman, but right now we're talking about the long-term care ombudsman program. And so that focuses on people who are residing in long-term care, skilled nursing facilities, adult care facilities, rehab units in skilled nursing facilities, and in New York State family type homes. You can, so we came to be because of the Older Americans Act. In the early 1970s, to improve nursing home care, this Older Americans Act was created, and it is continually updated every few years to add new authority to the program. And I just want to point out the latest one in 2016 added the LICOP was considered a health oversight agency for the purpose of HIPAA, which I think is neat. But under the federal regulation, this is what the ombudsman program is here for. So again, in skilled nursing and adult care facilities, we investigate and resolve complaints. I get a lot of phone calls or emails as well from both residents and concerned family members about issues that are going on in the facilities. So we go in there and talk with the residents and help resolve their issues. It's also about educating. Excuse me. So we want to empower the residents to know their residents' rights and being able to use that on a daily basis and know, especially in skilled, but in adult care too, that this is your home. This is where you live. The staff work there, but you live there, 24 hours a day. So making sure that you're receiving the quality care and respect and dignity that you deserve. We also promote resident and family councils. If invited, we attend resident councils as well. It's a great place to share your concerns with the ombudsman and educate you on the program. And the same with family councils. We can help kind of put those together, get you in touch with some great resources and other facilities that have already gone through the family council, kind of getting you all talking to make sure it's as effective as you want it to be. And also in the Older Americans Act, the residents have access, we have access to all long-term care facilities without interference. So we're allowed to go into the facilities, 24 hours a day if we want. 24 hours. Access to residents and medical records with consent. So that's what I just mentioned with being a health oversight agency. And so with the residents' consent, if there's an investigation going on and we need to see those records to get confirmation on something, then we do have the ability to do that. And actually I forgot to mention, I think, that the Region 15 covers Niagara, Erie, Chautauqua, and Cattaraugus County out here. But it said it is a federal program, and every state has it, and every county has it. Each state runs it a little bit differently. But in New York State, so we're Region 15, so Region 1, and there's a slide coming up. Region 1 is in near New York City and Long Island. And our Albany office is the state office. So we have a state ombudsman. Her name is Claudette, And then she has a team of folks working under her that we all work together with to kind of, systems advocacy and providing resources for each other to help the residents. There's a question here. Yeah, no, so our region, yeah, like I said, in this slide here, region 15 is red, and that's where we cover, my office covers. And in this particular region, we're housed within People Inc. So, because I know it can be kind of confusing at first. So, we are federally funded and state funded, and then within each of the 15 regions, a different nonprofit entity kind of, bid on us and said we want to house this program within our organization. And so within Western New York, we're under People Inc. I know a lot of people might think of us as just OPWDD, but we also deal with senior services as well. Okay. Is there something on the slide? I'm not sure if I missed the last slide. Okay, thanks. So this is just within New York State here. So we have about 1,500, long-term care facilities, including, skilled nursing facilities, and over 160,000 beds. And it includes skilled nursing facilities, adult care, family type homes. What are family type homes? We don't have that many in this region, and I think they're more common in maybe other states and other regions. We only have 2 right now, but I have a definition here I want to read of family type home because they're more unusual, but it's kind of it's an interesting concept and could be something we see more of in the future. But family type homes are private homes or apartments either owned or rented by the provider. They deliver in-home supportive services for individuals who are at least 18 years old with an intellectual disability and attending a day treatment program, or with a physical developmental disability and unable to fully live independently. So, for folks who need, nursing care, care is provided in a family type atmosphere, and each home is they can only have 4 or less adults, and they cannot be related to the operator. So that's interesting. And operators are not required to have specialization education or experience beyond homemaking skills. And what also makes them different is that we follow the Office of the Aging, but the family type homes are certified and inspected by the Office of Children and Family Services. So as you can imagine, it can be quite an undertaking for people to get that going. So I think that's why we have as few ones as we do in this region. So I just like to educate people on that. Okay. Oh, and the number of certified volunteer ombudsmen that's a lot. We have a lot in New York State. So again, in some states it's run by staff, in some states it's volunteers, and in this New York State it's both. So each region has an awesome office of dedicated staff, and then they have their own certified, like I call professionally trained volunteers, because it takes about 36-40 hours to go through the full training to become an ombudsman. There were, as you can imagine, there were more prior to COVID, and at least in this region, so we have, again, in this region we have 60 skilled nursing facilities and about 60 adult care facilities, and unfortunately we have as many volunteers as we would like to cover each one. That's the goal. So we are training right now, so if anyone is interested. You can, yeah, there you go. So what do we do as ombudsmen? Again, ideally we have a professionally trained ombudsman, assigned to each facility. And that means that, their goal is to get in there at least 2 hours each week and, walk the halls, educate themselves to the facility, get familiar with them, introduce themselves to the residents, make sure that they understand the program and that we're there as an advocate for them. We're not affiliated with the facility, and we're there to listen to them, and whatever they need help with, we're there to help. And these are supposed to, under regulations, supposed to be in every facility. This poster right here, and very visible. Each unit, I think, it actually is supposed to have one each, so each floor. So, please look for them if you go into a facility, and if you don't see them there, you can let us know that the facility isn't following regulation. So be on the lookout for those posters. And excuse me. Sorry, I know it's getting 10:50. I'm talking too much. So the ombudsman roles. Let's say a resident will call me, and they have a concern. So I'm listening, and investigating. If they want me to, would you like me to look into this further? Would you like, if sometimes not, sometimes they just want to, just educate themselves and what their rights are. Sometimes they are worried about, retribution and retaliation. So then we don't go forward with the issue. But if they give us the go ahead, yes, you can talk to the staff on my behalf, to find out, to get to the bottom of this, then we will investigate. But a big role is educating, 100%, walking the halls, letting residents know their rights, introducing ourselves to the staff, especially with all the turnover, let them know who we are, why we're there, and also provide resources to the staffing. I know Center for Elder Law and Justice also does training for the staff. We attend care plan meetings, both in adult care facilities and skilled. You can ask for, they happen less frequently in adult care facilities, but they do happen. Sometimes they should let the resident know. Maybe it's quarterly they happen, but you can request one at any time. And that's just when you get everyone together who you want on the staff and into a room, and we talk about short-term, long-term goals, and what the care plan is for the resident, and we can be there to help support. Let's see. And yeah, systems change advocacy. Especially with the Center for Elder Law and Justice, they do a lot of work at the state level, and so does our state office. Really trying to push, new, better laws and regulations into place, like minimum staffing. So that is a part of our role as well. So I think I just kind of went through this, but so the ombudsman, this is a flow chart of what happens when we get a call or we're in a facility and someone wants to talk to us. Again, we clarify the issue. We get permission. If we don't, that's fine. We had a nice talk and educated the resident. But if they want us to, give us permission, then we will go to the key staff, and we'll come together. Again, often a care plan meeting is just like the first step. It's nice. The resident has the floor, and they can share their concerns and requests with the staff directly. Sometimes, there's so many people that work in a facility, you don't know who's who, coming and going out of your room. It's nice to put a face to a name, to a job title. And then we will follow up. Okay, these are the goals, these are the requests. What happens? What's the outcome? What's the resolution? So we'll check back with the resident and the staff, and of course they can always continue to give us calls to see if it's they're actually following what they said they were going to do. And yes, our goal is all about the resident. So whatever the resident wants, and there's a phrase that can be kind of surprising to people, that we don't actually act in the best interest of the resident, meaning that we're not doctors. We're not there to say you need to eat this food, don't eat that, don't smoke, don't we're all adults, and we're all allowed to make our own choices, and even if they're risky, if they want to and have the cognitive ability to know the outcome and risks, then they can do that. If they want cake, then we'll help them, make sure that they get some cake, at the end of the day. So it's all what the resident wants. And if a family member calls in and they have concerns, but we go to the resident and they don't have concerns, and the resident doesn't want us to, look into it, then that's what we're there for, the resident. So. And yes, this is our contact information. Like I said, in Western New York here, Erie County, we cover Erie County, Niagara, Chautauqua, and Cattaraugus. But like I said on that map, every inch of New York State is covered by one of us. And you can, that link right there will get you to the state website. Then you can find your local ombudsman by your county. Any more questions? Did you just see the slides to be available after? That was a question.
I did see that. So for everybody who's joined today, you will be able to find the slides as well as this recorded presentation on erie.gov/ELD. So it's going to be the same website you actually registered on. There is one more question in here.
Yeah.
Does your office provide objective advice on buying long-term care insurance in advance?
No, we don't provide advice on that.
I would point you in the direction of a geriatric care manager. Would you, Bria, and about that?
Yeah, I know. Yeah, geriatric, and there's a couple. If you send, I know there's a couple, I just don't remember offhand, but if you send me, my email is right here. If you send me an email, I'll be able to give you the link to that information for a geriatric care manager and the number. There's a couple in Western New York.
But across the state as well, but they can be a very helpful tool for folks.
Questions at this moment. So I'd like to take a minute to thank Bria and providing us with all such great information. We appreciate it. Hopefully everyone's enjoyed your session today, and please join us next presentation on housing court.
Awesome. Thank you.
Thank you, ladies.
Yes, thank you, and again, thanks for all the questions. I appreciate it.
Yes, thank you.